कि आप लोग जो यहाँ पे पढ़ते हो ये जा करके डेफिनेटली आपने पढ़ना है। ये नेफ्रोटिक नेफ्रेटिक के ऐसे टॉपिक्स हैं जिसमें से पीएमडीसी यूएसएमएलई दे आर डेफिनेटली गोइंग टू आस्क यू पीपल। ये साइटोकाइन वाला हो गया, ये बाकी चीजें, ये इतने इंपॉर्टेंट क्वेश्चन और बस वर्ड पॉइंट्स है कि इससे सवाल बनता ही बनता है बेटा। मैं बेट लगा सकता हूँ इस पे, ठीक है? ओके एवरीबॉडी, so today we were talking about nephrology or renal system. Okay, so in nephrology we were talking about nephron. Nephron has got basically one major function, that is the urine production. Yes, the urine production consists of three major things. One is known as filtration, reabsorption, secretion. The filtration of it to the blood is due to glomerular filtration barrier that is composed of endothelial cells, basement membrane, food processes. Food processes have got three names. Food processes, epithelial cells. Yes or no? No. कोई चीज गुजर करके आगे जाएगी या नहीं जाएगी, ये दो चीजों पे डिपेंड करती है. One is the size between endothelial cell and the slit diaphragm between two podocytes. And second thing is charge, the negative charge. And we are trying to conserve as much of the amino acid and proteins as possible. If there is damage to glomerular filtration barrier, what happens? Proteinuria. We talked about two things. One was nephrotic syndrome, one was nephritic syndrome. Nephrotic syndrome is whenever there is damage to glomerular filtration barrier in such a way that there is proteinuria greater than 3.5 gram per day. When there is proteinuria, there will be hypoalbuminemia because albumin is lost in the urine. Due to hypoalbuminemia, there is less oncotic pressure. There is edema. There is generalized edema, particularly periorbital edema. If there is loss of protein and amino acid, there will be less immunoglobulin. Less immunoglobulin, increased risk of infection. If there is loss of protein, antithrombin is lost, and antithrombin plays a vital role in natural anticoagulability. So we will have increased risk of formation of thrombosis. For that, we can give the heparin to patient. उसके अलावा क्या हो सकता है? The lipid is synthesizing more and more lipids. Liver is synthesizing more and more lipids. Hyperlipidemia. In nephrotic syndrome, we talked about two major diseases. One was minimal chain disease. Second one is focal segmental glomerulosclerosis. Both of them are nephrotic diseases. And the basic thing which is common in both of them is there is no immune complex deposition and there is effacement of food processes or loss of food processes. And it occurs due to cytokine mediated damage. The glomerular diseases could be of two things. One is primary, one is secondary. Primary is if there is anything that is attacking to the glomerulus itself. And secondary if that thing is happening due to any other disease, systemic disease like SLE, like drugs, like HIV or any infectious agent. Now, in minimal chain disease, it is the disease of pediatric group. Focal segmental glomerulosclerosis is a disease of older group or adult group. The minimal chain disease has got its association with the Hodgkin lymphoma, with the viral infection, or it could be idiopathic. Minimal chain disease responds very well to the steroid, while focal segmental glomerulosclerosis does not respond well to the steroid. Second thing, focal segmental glomerulosclerosis on renal biopsy. In minimal chain disease, there will be only effacement of food processing on electron microscopy. In focal segmental glomerulosclerosis, there is hyalinosis, sclerosis of the glomeruli, and that will be focal and segmental. If we see this scenario, a 5-year-old boy is presented by parents with facial puffiness and swelling around the eye, that is periorbital edema, especially in the morning. Urine RE shows heavy proteinuria, no hematuria, serum cholesterol level is elevated. Renal function tests are normal. The child responds really well to the steroids. What is it?
Minimal change disease.
It is minimal change disease. Thank you so much everybody.
और जो सबसे दरपेश चैलेंज है हमारा इस सूबे का, सबसे ज्यादा वो है सिक्योरिटी का. मैं अप्रिशिएट